All right, so let's talk about when a person is diagnosed with diabetes, there's type 1, which requires insulin.
Correct.
I wrote that down when you said it. And type 2 sometimes can be controlled through diet and exercise. Yes?
Yes.
Okay, perfect.
Very good.
So what happens when diet and exercise is not enough? Then what?
Well, sometimes, and I would say usually upon admission to the hospital or going to the doctor's office seeing high blood sugars, more ordinarily than not, the doctor will send the patient home with some kind of oral medication, especially if it's type 2, definitely insulin if it's type 1 patient. And also be told that they have to check their blood sugar and see what their sugars are at and then modify. Hopefully they'll send them to the certified diabetes educator or an RD at least to be able to get that education they need for meal planning, which is important.
So you have a little show and tell for us
I
in
do.
terms of what someone would do to check their blood
Correct.
sugar levels. Tell me how it works.
So there's many different types of glucose meters. The main thing is to get one that your insurance covers because the strips are very expensive. So in terms of the technique, you would want to use an alcohol swab, or you can always wash your hands with soap and water, that's fine. Just don't use the Purell or alcohol gels because then it could leave a residue.
Okay.
So you would just kind of clean off, let it dry a little bit. If it's wet, it'll kind of smear the blood. And then you want to put the needle inside. I already put one in here. You put the needle inside and you put the cap back on. And then you would want to put your strip in the meter that will turn the machine on. And it'll pretty much, within a few seconds, ask you for blood. Then you will, depending on the device, this is one right here, you will just kind of do this to prepare the needle. And I'm going to pretend to pinch myself right there. On the side, you have less nerve endings. Here you have more, so you feel it more. So a little trick to try to use the side.
Oh, that's good.
And then this particular strip has two little half moons. Sometimes it has a little thing in the middle. So depending where it's asking you to put the blood, you would just touch the blood to the side or to the middle, depending on what the strip is. And then within a few seconds, you'll get a reading. It's as easy as that.
And when you get that reading, how many do you have to have per day? Is it just one?
Yes. Well, usually it's twice a day if you have type 2. Sometimes if you have type 1 and insulin, you might have to check 4 to 5 times a day. So it can get a little tricky and monotonous in a way. There's also continuous glucose monitoring systems that you kind of is a device you connect and it checks your sugar every 5 minutes. So those are good if you definitely have to check more often.